statement on the declaration of cholera outbreak in Renk County, Upper Nile State. The Ministry of Health received a report of suspected cases of cholera from Muntau Primary Health Care Center on the 8th October 2024. Since October 11, 2024 up to date, a total of 33 samples of suspected cholera cases have been reported from Renk County, of which a total of 6 cases have been confirmed positive at the National Public Health Laboratory using culture. However, no death has been reported so far. The proportion of males among all suspected cases and confirmed cases is 47%, while 53% are females. The most affected age group is 15 years and up. The Ministry of Health, therefore, declares an outbreak of cholera in Renk County, Upper Nile State, South Sudan, based on confirmation of cholera by culture and confirmed evidence of local transmission in Renk area. The following measures are put in place to respond to the outbreak. 1. Activate an incident management system to respond mode. 2. Strengthen response intervention with a focus on multisectoral coordination, surveillance, case management, water, sanitation, and hygiene, that is WASH, infection prevention and control, IPC, risk communication and community engagement, RCCE, safe and dignified burial, points of entry, POE, and operations and logistics. 3. Establish and support cholera treatment unit, CTUs, and continue to collect additional samples of culture, additional sample for culture and PCR testing. 4. Develop an immediate cholera response plan for mobilization of resources to support the response interventions and containment of the outbreak. 5. Submit a request to International Coordinating Group, ICG, for oral cholera vaccines to conduct a reactive vaccination campaign. 6. With effort to establish evidence of local transmission and deployment of rapid support teams, the Ministry of Health, with support from WHO, has already delivered necessary supplies including rapid diagnostic tests, RTDs, cholera kits, and emergency health kits, and the Ministry of Health will continue to work with WHO and other partners to ensure response interventions are fully implemented and the people of South Sudan are protected. The public is encouraged to observe the following public health measures to prevent the spread of cholera and other diarrheal diseases. 1. Drink and use safe water that has been treated with chlorine or boil. 2. Always wash your hand with soap and clean water before cooking and handling food, eating and feeding children, and after using the latrine or toilet, and or cleaning children after they have used the latrine and or toilet and after taking care or touching a cholera patient. 3. Use latrines to defecate. Do not defecate in or near a source of drinking water or in open places. Cook food well. Keep it covered. Eat it hot and peel fruits and vegetables. Always wash fruits and vegetables thoroughly with clean and safe water before eating them. And 5. Keep a clean environment at home and in public places and dispose of liquid and solid waste safely. The public is urged to remain calm and observe all the above measures to prevent further community transmission. The public is further urged to be vigilant and report all suspected cholera cases to National Outbreak Hotline 6666 or the nearest health facility, County Health Department, and or State Ministries of Health.
نحن في ولاية على النيل ظللنا لمدة أسبوعين بنعاني من إسعال مائي موجود في منطقة تاع ونطاو، ومنطقة ونطاو هي منطقة حدودية مع السودان. فنتيجة للمشاكل الموجود في السودان يمكن حصل النزوع ده سبب بوجود كثافة سكانية عالية جدا في ولاية على النيل، especially المنطقة بتاع الرنك ومنطقة بتاع مانيو اللي هو مقاطعتين اللي في الحدود. فالتكدس بتاع السكان يمكن تسبب لحاجات كثيرة. واحد من الأمراض الظاهرة ده إنه الكوليرا بقى موجود عندنا هناك. نينا ما بنلوم زول، لكن دي مصيبة جات علينا كده كولاية. الأسباب بتاعه كتير. أول حاجة في فيضانات متأثرة على ولاية كله. نمرة 2 الكثافة السكانية، يمكن في فقر بتاع الحمامات والموية نظيفة، وبرضه تكدس بتاع أسرة واحدة في البيت بقى بيسبب لنا مشاكل. فنحن بنشكر الوزارة إنه خلال الأيام الفات يمكن رسلوا تيم عشان يدعموا الولاية، والولاية برضه نحن كونا تاسك فورس من رئاسة الولاية إنه يمشوا يقعدوا في الرنك. يمكن أنا ذاته جيت هنا لطريقي للرنك لأنه ما عندنا وسيلة بشيلني بيتحد الشارع ما كويس شوية. جيت هنا إنه على أساس أمشي الرنك وأكون واقف على مع مدير الخدمات الصحية موجود في الرنك، أكون موجود في الرنك عشان نقدر إنه نقلل من الخطر ووقوف بتاعنا كحكومة بتاع ولاية. فبنشكر وزارة الصحة الاتحادية وبنشكر الإعلام برضو، وبنطلب منكم كمان إنه أنتوا تساعدوا في التوعية بتاع مش بتاعنا برانا في الرنك، لكن ممكن المناطق المتأثرة بفيضانات كلها ممكن يظهر فيه كمية بتاع أمراض يعني.
Undermine a lot of the progress that the country has made so far in the health sector. When we look at this from WHO side, we are quite happy with regard to the capacity to pick up the problem. I think this is a result of a lot of years of investment by the ministry and the partners in the surveillance capacity. So in many countries, or even in the past, we would be 2 or 3 months late. But just within the month of October, we've been able to detect, to culture, and come out and make a declaration in quite a short time. So I think that's something which it fills us with a lot of hope. The second area again is that all the people who have had suspected cholera have all recovered and gone home. That's another very strong positive. It means that there's really something on the ground, something good in terms of being able to respond to the needs. So that's a huge positive. I think the key challenge that we need to keep a close eye on is the spread. Many of the cases that have come so far have been either returnees or people associated with activities in Sudan. These people move across the country, and we just need to make sure that we keep our surveillance in Juba, in Malakal, in Maban, in all these other areas, to make sure that if there are any cases, we're able to pick them up. We've at least proven that the system on the ground can pick up and respond to them. So we are strongly behind the government's response. All the areas which the ministers highlighted as key areas, these are areas which we're also looking and saying, how do we then support the response so that we do not lose any South Sudanese due to cholera. We'll also be working quite closely with all the partners to make sure that the resources, the capacities that are required can be made available to the country so that, again, we are able to respond to this well. My hope is that that we can give the people of South Sudan a good Christmas, free of cholera. Thank you. Yes.